Bunions, crooked toes, what can we do about it? Welcome to Talking with Docs. I'm Dr. Brad Weenie.
And I'm Dr. Paul Zalzal.
I'm Dr. Danny Aurora. Thanks for having me, guys.
Welcome.
Awesome. Dr. Aurora is a foot and ankle specialist, and he's come here to share some of his expertise on bunions. This is a very, very common problem that is very debilitating for many people. So we're going to start at the beginning. What is a bunion?
Yeah, so a bunion, I think the biggest misconception is a lot of people think that it's a growth, like a bump that's growing on the toe. So people come down, they see me, say, hey, Dr. Aurora, can you just shave down the bump? And then I say, well, listen, we could do that. However, your toe's still going to point the same direction it is. So that I would say is the biggest thing. Definitely bunions are very, very common, probably the most common thing that I see in my practice. I think the biggest thing is a lot of people are coming for symptomatic treatment. They want to know, could they get the pain down? They want to know, could they get their toes straight? I think the biggest thing is symptomatic bunions and cosmetic bunions.
All right, so bunion, the misconception is that it's a bump on the side of your foot or at the base of your toe, but what you're saying, in fact, it's not just a bump, it's more a toe that's angled the wrong way.
Correct.
That's causing the problem.
And fun fact, the term, I looked it up, comes from like the late 1800s, this guy named Carl Reuter, and it comes from a Latin word called bunio, which actually is a turnip. So I guess because of the bump, they said, hey, it kind of looks like a turnip on your toe. Hey, turnip toe.
Turnip toe.
Turnip toe. So, okay, so someone shows up at your office, and they're mostly coming for, so like you said, either pain or cosmesis.
Yeah.
What do you do when you first see them? How does the consult go?
So I think the first things first is ask about their symptoms, when they're having their pain, if they have pain, where is their pain? And then the second thing would be if they have any other toe deformities. A lot of times bunions, because of the big toe being the captain toe, basically you get secondary toe deformities. So
Right.
a lot of times the lesser toes, which are the smaller toes, tend to curl up and you get hammer toes or pain underneath the toes on the lesser toes specifically. And that a lot of times is the thing that drives us to do surgery.
Okay.
Like the domino toe effect.
Domino
Exactly.
toe. So let's talk about risk factors. There's a lot of controversy in the literature about what caused it. Is it your parents or is it your shoes?
I think it's a bit of both.
Okay.
I think the biggest thing is probably hereditary or genetics. In the old days, there was that misconception, or at least the theory that people were cramming their toes, people were wearing all these tight shoes, the high heels and all that stuff. Technically, it can lead to that because essentially you are cramming the forefoot or the tips of the toes, which essentially squishes the big toe into the lesser toes, creates more of that prominence on the side, more rubbing effect, more swelling, and again, more pain.
So shoes can cause it then?
Yeah, I think so. I think it could accentuate or exacerbate symptoms. I don't think it's necessarily the root cause of bunions nowadays. I think it's more of a hereditary component.
So the genes are more...
Unfortunately.
So if your genes match your shoes, you're in big trouble.
Yeah, and there's actually one shoe company that based their shoe off of the Maasai warriors of like Kenya and northern Tanzania, because they actually are mostly barefoot, or they make these shoes out of tires, and they've resisted technology. They're almost like Mennonites of Africa, and they walk like 60 kilometers a day, like attending their cattle. And some people think, well, hey, they don't have bunions. Maybe we should all just wear shoes like them. But I think that's been broken down.
Is that where the Birkenstock came from?
Well, possibly it's kind of the style, right?
All right. Got
Yeah.
it.
Anyway, there's the history of the Maasai. Okay, so they come to your office, you've done a history, and then on physical exam, what are you looking for on physical
Yeah,
exam?
so I think the first thing is obviously look at both feet standing up. I always look at both feet to compare. And then you look at what's going on with the toes, right? You want to see if the big toe is really deviating into the smaller toes or the lesser toes. And when you do that, number one, you see that the big toe deformity, you look at the lesser toe deformity, see what's happening with the smaller toes. And then you want to see the flexibility of the big toe.
Okay.
So I think a lot of things do people have underlying arthritis in the first MTP joint, which could then, change a bit of the treatment if we're talking about surgery.
Your first MTP joint is the joint at the base of your big toe.
Yeah, the metatarsophalangeal joint. So it's where the big toe meets the actual forefoot,
Right.
or the foot itself. If it's flexible, that means we can technically correct it. If it's very rigid and there's no range of motion,
Yep.
then sometimes there's underlying wear and tear or degenerative changes in the toe, which a bit changes the management.
Separate issue.
Yeah. So I guess that would be number one. We also get x-rays, always standing bilateral feet x-rays to see what's going on an x-ray level. And then that's where the discussion with surgery or no surgery comes in.
Now you mentioned bilateral. I'm assuming that because we're symmetrical beings, most people have bunions on both toes when they come to see you.
Yeah, I mean, I would say very commonly yes, but a lot of times one foot is worse than the other.
Okay.
And then sometimes people come with one side only.
Okay.
Okay, can we jump into treatment now then? We mentioned operative or conservative, operative versus non-operative, or operative versus conservative treatment.
Yeah.
Why don't we run down the non-operative?
Yeah, I think the first things first, a lot of times is non-surgical would be the first way to go. A lot of times patients are coming more for guidance. They're not ready to just jump into some type of surgical treatment. So usually would be wide shoes, number one. And then when I say wide shoes, it's not a shoe that's wide then narrow at the tip. It's really wide shoes. And a lot of times people are not happy when I say that, because then I tell them they got to wear something a little bit different, because they come in with very,
Then
very
you give
narrow
them 3
shoes.
balls, attempt to learn how to juggle.
And they're talking about the toe box, right? So essentially, add the toes, we want it to be out.
Yeah,
right?
you
Not
want
pushing
room
those-
for the big toe and the small toes to kind of live and breathe.
Right.
Comes
You don't
with
want
a big red nose.
exactly.
I was going to say, they do look a little clowny, right? The wider they get
Just
at the
saying.
toes. Yeah.
Just saying.
Sometimes.
Okay, so wider shoe. Okay, number
So
two.
wider shoes. Orthotics can be helpful sometimes to offload the big toe.
Yep.
And sometimes the pain that happens on the other toes, because you could get what's called transfer metatarsalgia. It's basically a big word that makes me look smart.
Right. You do.
You look
Yeah.
smarter already. Yeah.
Looks like you accidentally used Rogaine instead of shaving cream this morning.
Oh yeah.
You got the 5 o'clock shadow by
The
7
gift of
a.m.
beard.
Yeah.
Nice.
So sometimes you get pain in the lesser toes because you start overloading the other toes and try and not put so much weight underneath the big toe.
Okay.
So this is the idea of change the shoe to fit the foot rather than changing the foot to fit the shoe.
Correct. And we could get to what you just said.
Yeah.
That's where surgery comes in.
Right.
Okay, so the other non-op stuff to address some of the YouTube and TikTok videos that are out there that are telling you that they can cure your bunion with these things. How do you feel about toe spacers, toe splints, and physiotherapy or stretching exercises?
Yeah, so I do routinely recommend sometimes using, spacers. There's specific splints.
Right.
There are those toe deviators.
Yeah, where they actually wraps around your ankle and kind of pull
Yeah,
that big toe
I think
over.
essentially the big premise for that is we want to basically align or straighten the big toe,
Yep.
which allows for more room so you're not crowding into the smaller toes, but also the deviation of the toe, when it does that, it decreases that bony prominence and that
Right.
rubbing effect, and the bump doesn't go away. However, you do have less irritation and rubbing in your footwear.
Makes sense. Does it work?
It works to alleviate the symptoms. I don't think
Okay.
really these things will then miraculously make your toe straight and you'll never have to have anything
Okay.
potentially done.
Yeah, and the literature didn't seem to support either slowing the progression or reversing the problem, just symptom relief.
Symptom relief.
Yeah.
So that's not usually what I tell my patients.
Which is a
But
big deal. Symptom
Yeah.
relief.
And if you can live with that, if you say, I just don't want to have surgery, if you can reduce your symptoms, maybe that allows you to avoid an operation
Correct.
that maybe you're hesitant to do.
And I think the biggest thing is once we say, that would be the non-surgical management, then patients are like, well, listen, can you just fix my foot?
Right.
As soon as you start talking about the surgery, a lot of times patients get scared away and say, wait
Sure.
a second, I'm not ready for such a thing.
Right. What about anti-inflammatories, either orally or topically? Is there any role for that kind of stuff?
Yeah, again, for all symptom management. So if you do have a lot of swelling locally over the bump, you could put an anti-inflammatory cream that could sometimes help for decreasing some of the symptoms.
Yep.
Oral anti-inflammatories, as long as it's okay with your family doctor.
Sure.
Again, that's all just symptom relief.
Okay.
Okay, that's the non-operative route. Now let's jump into surgery. What
Yeah.
kind of surgery are we talking about? As I recall, there are many different surgical procedures as options to treat bunions.
Yeah, so I mean, there's over like 100 types of bunion procedures. I think the biggest thing, in recent probably few years is the push for minimally invasive surgery in the feet, specifically for bunion surgery. And I think that has really changed the game of what we do.
What does that mean for a patient? Because obviously it's a catchword, it's a way to market, stuff like that. What does minimally invasive mean to the average patient?
So MIS, minimally invasive, essentially what it is, classic way to do a bunion, we used to do big incisions,
Right.
A lot of soft tissue releasing, a lot of dissection, which would lead to, potentially wound complications, longer time for things to heal, bigger recovery from surgery, a lot more swelling post-op and pain. And minimally invasive, right now we do everything through little poke holes.
Awesome.
Wow.
Very
So a lot of times when I say that, patients are really, surprised and, really happy to hear that. So essentially what it is, a couple little poke holes, we do break the toe to realign it.
Okay, so realignment is one of the goals.
That's basically the main
The goal, okay.
Yeah, so the big goal of bunion surgery is to realign the big toe to make it nice and straight and to decrease that bony prominence.
Right.
So a lot of times what I'll talk to you about with the patients is, everything's done through little poke holes, usually no stitches are required. It is sometimes a big shift, so you're essentially making the bones that are now, straight at first, crooked toe.
Right.
So I tell them we're gonna make your bones crooked to make your toe straight.
Okay.
Okay.
I like
and then is there some hardware there to hold the bone once you
Yeah,
break
so
it?
there's different techniques. Some people use, percutaneous K wires. I prefer using 2 long screws. So there's
Okay.
2 screws that hold the shift in place, and essentially those screws stay in.
Okay.
What that allows for me is I could get my patients walking on the foot right away. They
Oh,
use
really?
our hard sole sandal, which is on for the first 6 weeks after the surgery.
Okay, so you're wearing a fancy sandal for the first 6 weeks after the surgery, but you're allowed to walk on it.
Correct.
Surgery-wise, typically done under like a regional anesthetic with some sedation.
Yeah, so that's the big thing too, is because of the small surgery we do it. I prefer to do that way. Quicker recovery for patients.
Go home the same day?
Go home the same day surgery. Surgery takes about 45 minutes.
Average time off work.
So that depends on what type of work you do, right? So if you're a lot on your feet, it does take a little bit longer. It could be sometimes up to 3 months off work if
Yep.
you're doing a lot of manual labor and all that. Desk job, you could technically be back. Just have to manage your pain and your swelling.
All right, and my favorite thing, risks and complications. Every surgical procedure has the chance of something bad happening. So what are some of the risks and complications that can happen with bunion surgery?
Yeah, I mean, like every surgery, right? Anytime you cut the skin, theoretical risk of infection, risk of, bruising, stiffness, nerve injury, tendon injury, vessel injury. I think the big thing, because we are technically creating fractures in the foot in the sense, but we're breaking the bone, risk of non-union, delayed union, malunions, small risk of blood clots after surgery. Everyone gets some type of DVT prophylaxis, which is just to prevent blood clots. And then chronic pain in the foot.
Okay, so while there are risks, like many surgical procedures we do, the risks are very, very, very small, but you need to be aware that they can happen before you decide on your own if you want to do this elective procedure.
Yeah, and that's something we always talk about, when we're talking about the surgery, or the pros and cons of the surgery, and obviously the risks and benefits of it as well.
Now, if I get this surgery and I have beautifully straight toes now, I can go back to my really tight-toed shoes and it's never going to come back, right?
Well, now, first of all, you'll walk straight, so you won't be walking in a circle because your
Okay.
toes are going in a
That's
different
good.
direction.
That's good.
Definitely do not recommend doing that, because essentially you're just recreating technically the problem.
Right.
It doesn't mean you can't wear those narrow shoes, but obviously it'd be something to be more in terms of wearing a wider shoe.
Sure,
You got to
sensible.
protect your investment.
Right. Agreed.
Socks and sandals from here on in.
Oh, mama, that's a bad look. Okay, that is an awesome summary of bunions right from A to Z. So please let us know your experience with bunions in the comments. And if you like this video, please like it, subscribe to our channel.
I kind of wish I still did bunion surgery. I used to do a lot in the beginning of my career,
Same.
but because then I'd be like Dr. Paul Bunyan. That would be my handle.
Paul Bunyan.
Fix your bunion with an axe. Clear it
Kinda
all.
did back in the day.
Remember, thanks so much, Dr.
Yeah,
Aurora.
My pleasure. Happy to help.
Remember, you are in charge of your own health.
We'll see you next time.